Hello dear friends, my name is Dr. Igor Atabekov. I'm clinical oncologist practicing since 2010. Today we are talking about very common problem about bloating, gas, the pain in the belly, constipation, diarrhea, about the symptoms that can be connected to excessive growth of bacteria in your bowel. I'll tell you about the diagnosis of this condition, about treatment, and we will talk about the special diet. This is called low FODMAP diet that was developed in Australia. I will give you the list of the foods and it will be available for your free download. So let's get started. So, in our small gut, there must be not too much bacteria, not too many inhabitants, because all the food that we eat, it must first be digested, absorbed, and our body must get all the nutrients we need. And then all the remaining, what we cannot digest, will go further into the large bowel, and it will be eaten by our microflora, by our microbiome, bacteria, that will also be grateful to us because we feed them. But in some situations, the bacteria may grow too much, may spread and go to our small bowel and live there and consume our food, and during eating that food they will produce a lot of gas and will have bloating and all the stuff, maybe abdominal distension, pain, and nutritional deficiencies, vitamin deficiencies, maybe weight loss, and many other problems. What can be possible mechanisms? The bacteria may go from our mouth, throat, from our lungs, and be swallowed with saliva. And if we don't have enough barrier of our stomach, for example, the person has atrophic gastritis. I made a video about it not far ago. Or the person has low bile and low function of pancreas. These things are antibacterial and antiparasitic, by the way. They will stop excessive bacteria from growing. That's why any problem with those components, we may have increased bacteria in our guts. Next, many people intake their drugs to decrease acid production in stomach, for example, omeprazole. And we know that the longer the person takes omeprazole, the more chance he will have increased bacteria in the stomach, or SIBO, syndrome of intestinal bacterial overgrowth. For example, if the person takes it for more than 1 year, more than 60% of patients will have SIBO. If the person has low bowel motility, their bowels are lazy, not moving very well. For example, he's taking different sedatives like benzodiazepines or opioids. This may also lead to SIBO. And bacteria may grow from lower part, from large bowel. For example, the patient has diverticulosis, or patient has inflammatory bowel disease like Crohn's disease or ulcerative colitis, or irritable bowel disease, or irritable bowel syndrome. That all are risk factors for SIBO. We already talked about symptoms that can be bloating, too much gas, flatulence. It can be a lack of digestion, nutrition, problems with stool, diarrhea, constipation, weight loss. Symptoms may increase after food, after minutes or hours, but elderly may be asymptomatic, by the way. There are many methods to make the diagnosis. Some are invasive, means you need to swallow the tube with camera. They will take the samples from your duodenum, they will check the bacteria there, and they will do the diagnosis. But more comfortable is, of course, non-invasive procedures. For example, the breath tests. Hydrogen breath test, the patient takes glucose or lactulose, and they measure. This lactulose will be digested by bacteria, and the hydrogen will be released, it will be absorbed to blood, and the patient will breathe it out. And we measure what he breathes out. Before taking lactulose, the patient will check hydrogen, and then every 15 minutes after taking lactulose for about 2 hours, we will check his hydrogen levels, and we'll see that if there is too much bacteria, then hydrogen will be released too fast, and we'll see a lot of hydrogen very fast in the air he breathes out within 30 minutes after intake of lactulose. These breath techniques, tests, they are prescribed for many reasons, not only SIBO, but many food intolerances, for example, or inflammatory bowel disease, or problems with pancreas, with bile, with irritable bowel syndrome, with cirrhosis, many reasons to do this test. And we shouldn't forget that there are other important aspects to check, for example, food allergies. Usually we need to check for antibodies against different types of food. Also, many patients may have also lactose intolerance. By the way, if you check for lactose intolerance and it's negative, but still when you take milk products, you still have problems, maybe you have intolerance to other components of the milk, not to lactose. And also gluten hypersensitivity. Gluten is also one of possible causes of symptoms. Next, we have the diagnosis of SIBO. What should we do? We should get rid of too many bacteria. Usually they use antibiotics. Number one is rifaximin, because it's not well absorbed in the guts, and it has not much bacterial resistance. But also there are other antibiotics available as alternatives. And then we need to restore the microflora, microbiome. We can use probiotics, alive bacteria. We can use prebiotics, the food for bacteria, the fiber. And we can use metabiotics, the products of these bacteria. Also, if the patient has problems with digestion, for example, I told you about problems with pancreas or not enough bile, the patient may actually need enzymes of pancreatic enzymes, or may need the bile supplementation. There are many problems with probiotics where we don't know exact doses needed for the patient. Not all probiotics are not totally safe, even if we are talking about lactobacilli or bifidobacteria, but enterococci, streptococci, Saccharomyces are even less safe. Sometimes they can even cause some infections if you have low immunity, or they can increase the dysbiosis. They can sometimes increase inflammation. And according to one meta-analysis, based on many clinical trials on humans, probiotics don't decrease the incidence of SIBO. They can help with pain. They can help with getting rid of SIBO during treatment. That is good. But they are not very helpful against diarrhea. Metabiotics. I told before when I was talking about probiotics in different gastrointestinal diseases. Watch this video, by the way. It has a good comparison. I was talking where it's effective, where they're not effective. And I was talking about metabiotics. What is that? This is the substances that these bacteria will produce during their life. And if we take just supernatant, it means there are bacteria, and over them there is some fluid. And this fluid is full of these bacteria substances that they produce. And if we just take this fluid, we get all the effects that we get when we take the bacteria. That means really not these alive bacteria are doing effect, but the substances that they produce. That is safer, and we can get a lot of good effects. That's why now they're investigating metabiotics more than before. It's the same principle as with mushroom mycelium. When we grow it on grain, mycelium eats this grain, produces substances into this grain, then we dry it up, the mycelium dies, but all the substances are left. The patient takes these substances in microdoses and gets a lot of interesting effects. I have a full playlist on medicinal mushrooms, and this is a very interesting topic. There is one problem. After treatment of SIBO, we can get relapse, recurrence, and maybe because this person already has some reason to have SIBO, and if this reason is not corrected, he may have it again. So if the patient has more than 4 episodes of SIBO a year, plus some risk factors, for example, the diverticuli of jejunum, these patients may need the antibiotic prophylaxis, taking 5 to 10 days of antibiotic every month, sometimes changing them to prevent resistance. And also, by the way, physical activity, at least 30 minutes, 3 to 5 times a week of average exercises is really helpful to decrease the symptoms of SIBO. Prebiotics, we need to eat the fiber, it must be soluble fiber, and approximately 30 grams of fiber per day would be fine. Why do we need fiber? Because we need to feed our good bacteria, because they will produce short-chain fatty acids that are needed for health of all our organs, of our heart, muscles, brain, kidneys, and for health of liver. We should not forget that in patients with SIBO, there may be some micronutrient deficiencies like vitamin B1, B3, B12, A, D, E, K vitamin deficiencies, and iron deficiency. That's why if the patient has this problem, he needs some supplements. Dear friends, thank you for your time, thank you for listening to me. I would appreciate if you write any comment in the section down below. I want also to thank our sponsors who support our channel. These are their names, and if you want to support this channel, you can also become our sponsor, or you can find the links under this video. In the next video, I will tell you about the low FODMAP diet, what foods are allowed, what are not allowed, as the remedy for treatment of SIBO. Very effective remedy, by the way, as alternative to antibiotics. That's why please come to the next video. I wish you good health, have a good day, goodbye. Don't be